The Health Ministry has taken another step forward in its effort to provide specialised care for patients going through the last stages of their lives. It has appointed a task force to study the recommendations for a national strategy for palliative care. Health Minister Gan Kim Yong announced this when he opened new facilities at Dover Park Hospice. Sarah Gross with more.
A new wing at the hospice means 10 more beds for patients. Dover Park Hospice, which has been providing home care service for its patients, plans to increase capacity as well as expand its service. One way is to work with hospitals and inpatient care providers.
We can arrange for direct admissions to the hospitals, and at the same time we can quickly bring them back home, or if they need direct admission to the hospice, we do not need to re-refer to an inpatient service. We could continuously care for them in a more seamless fashion.
That's an area that the Health Ministry's work group of health professionals is proposing. It's looking at an integrated system in the form of regional health clusters where patients can receive palliative care while at home with GPs or at community hospitals. Another key thrust is ramping up training in palliative care for all healthcare workers by making the subject part of the curriculum of undergraduate healthcare courses.
We want every patient to be looked after with a holistic approach. And this is part of the palliative care approach, which we hope every healthcare worker from their training days would be able to acquire and see the patient not just as an organ system or a disease, but in the larger context of who that person is.
The work group also stressed that it's important to raise awareness of end-of-life issues through public education.